great.
The service comments. I'm not sure that I gave enough uses. How the case is presented is key, and I think choosing the X-rays, which you have done, you've gone through the presentation, with both our cases really. Right? And he says, you guys usually show these cool pictures of the patients in the frames,
Smiling in the frame.
There was nothing in the frame. All right, so let's get to work.
Let's do it.
All the stuff that we're doing. I'm just proud.
Should have shown me this case?
Yeah, this is this is the whole transport, acute shortening, lengthening. This was referred to me by Dave Asperino, who's
up in
Westchester. I was an orthopedic surgeon at the hospital for special surgery. Some of the most complicated post-traumatic cases were very challenging for us. We didn't have good solutions for patients who had bone loss and big deformities. A lot of patients were having amputations for advanced severe trauma. And I became more interested in learning these techniques of limb lengthening reconstruction that would allow us to deal with these complex deformity cases, limb salvage, post-trauma cases, severe birth defects. And really there was nobody doing it at the Hospital for Special Surgery, which is the premier orthopedic hospital institution in the country. I had spoken with the chief at the time, and he was very excited about developing the program. I got some additional training and came back and started this service at the hospital. It just took off. The alignment looks great. Those center hip to center ankle lines that we use for the alignment are really right down the center on both sides. So I'm really pleased about that.
Me too.
It looks great. I don't think that we really need to do any more turns.
Good. Can let them heal.
We'll do a BMAC injection on the first side, just like we did the first time around. I think that'll make the most sense.
Okay.
After I had been in practice for a few years, I started a fellowship. Austin Fragaman was my first fellow.
I graduated from the State University of New York at downstate. I did my residency at the St. Vincent's Catholic Medical Center. When I was in the middle of my residency, I thought that I would probably be doing sports medicine. I started recognizing that there were some problems with the standard techniques that were being used for general orthopedics. So I started getting very interested in the Elizaroff technique and started seeking out people that were experts at that technique. And that's how I met Rob Rosbrook.
I was giving some lectures on these techniques. Austin was in the audience at the time. He was a senior orthopedic resident, and he came over to me at the end and introduced himself. He said, "Hi, I'm Austin Fragaman. I'm really interested in the kind of stuff you're doing. I'd like to learn more about it, and I'd like to spend a year training with you." And fellowships are kind of like an old-fashioned apprentice system.
He brought me in to do the fellowship, and then we got along so well that he actually hired me out of the fellowship to be his partner.
With Austin, we actually officially started the limb lengthening and deformity service at the Hospital for Special Surgery. And over the past 5 years, the demand for our service has increased. We are committed to education, teaching the next generation, and teaching other surgeons who are interested in learning. So we train other fellows. We're constantly teaching in the clinic, in the operating room, in conference halls. We're also committed to research. We're always trying to figure out better ways to do what we do. Ways that are more efficient, more clever. It's fascinating. I mean, this comes up over and over again, is how powerful realignment is for improving knee symptoms and the progression of arthritis, or the lack of progression
On the
of
side that
arthritis.
had like sort of severe collapse on the lateral compartment, that side's doing much, much better, but she still has knee pain. On the other side, where the collapse was much more moderate, she's phenomenal. She feels no pain whatsoever.
We take care of orthopedic surgical problems and musculoskeletal problems from A to Z, from head to toe.
Excellent healing. Yeah, so the endocrine issues were not a problem. You have a very strong thigh,
Mm-hmm.
you would never feel this bump.
Okay.
But even so, over time, this will thin out a bit, probably to about half the size it is now. So you get your knees fully extended, the hips are level, feet are at exactly the same amount of rotation. This is very good.
Good. There are only a few centers in the world that really focus on limb lengthening, reconstruction, and deformity correction in the way that we do. We treat children and adults. We treat patients with upper extremity problems and with lower extremity problems. The common feature for these people is that they have problems that traditionally have been thought to be without a solution.
Other orthopedic surgeons will have a patient who they don't know what else to do for them, and yet they don't know that we do know what to do for them.
We also are dealing with more mundane problems in creative ways. If somebody has a bow leg deformity and is starting to develop arthritis in their knee, instead of just letting that knee wear out and that person getting a knee replacement at a young age, we will correct that deformity proactively early on and actually take care of the knee pain and prevent them from getting arthritis in the knee.
We move quickly, we jump on opportunities, and we're constantly improving our institute and improving care for patients without being bogged down with politics.
We want to take care of patients. We want to take care of limb length discrepancies. We want to take care of limb deformities, bone loss, and post-traumatic problems. We want to save legs. We want to prevent arthritis. Physicians and even orthopedic surgeons do not have a complete perspective on what is still possible. When I get invited and I give a grand rounds lecture at an orthopedic institution and I show the kind of stuff we're doing, I get people who come over to me afterwards, orthopedic surgeons, who will say, I did not realize that that was possible.